Assalamu alaikum wa rahmatullahi wa barakatuh. Peace and blessings be on you. Alhamdulillah, wa salatu wa salamu ala rasulillah. In the name of Allah, the most compassionate and most merciful. In the next few minutes that we have, what I need to discuss with you is the way forward for the Muslim community in regards to organ donation. It's probably the most difficult topic that I need to discuss with you. Before I do so, I'm not a medic, not a medical expert. I identify these issues in a theoretical way. So people like Arbada, they probably know better. I have been researching, investigating these issues, and not just organ transplantation, but many issues relating to medicine. In terms of the Muslim community's stance, and in terms of the Muslim community, how they can deal with the issue of organ transplantation and organ donation. First of all, we need to realize, and my address is not just to the Muslims here, maybe more directed to the non-Muslims, those who are experts in the field, those medics, doctors and nurses who work every day in the field. What they need to do maybe in terms of dealing with this issue and having this relationship with the Muslim community. Within the Muslims, we have basically two types of people. Okay, the majority are what we call, from an Islamic scholarship perspective, the lay people, and we have experts in the field. Now, you have experts; they arrive at a conclusion. They hold a particular stance and position with regards to organ donation because of the extensive research, like Arbada mentioned, because they study all the various evidences from the Quran, the Sunnah, and they arrive at a conclusion, and they don't even do it individually, it's collectively. He kept on talking about, Islamic Fiqh Academy of this and Islamic Fiqh Academy of that, because these issues, actually, the first time organ donation was discussed was in 1988 in Saudi Arabia, in Jeddah. The Islamic Fiqh Academy, they had scholars from around the world, approximately over 100, 200 major Muslim scholars, 1988, and that's the first time when they actually discussed these issues, and specifically organ donation, and their resolutions are published, printed. Much of this booklet, the articles taken from the resolutions of the Islamic Fiqh Academy of Jeddah. We have the Islamic Fiqh Academy of India and the European Council of Fatwa and many organizations. So we have the experts. But the majority of the Muslims are so-called the lay public. They do what they are told by their faith leaders. So for example, for me, I would go to my local mosque, and the imam there, the scholar there, or the sheikh there, or whoever that faith leader may be, I would ask him. I go to the Friday prayer, and I attend the Friday sermon, I attend the Friday prayers, and what he says to me is what Islam is for me. This is the majority, and maybe that's the same it's the same in other faiths as well. I will not be going deep into trying to weigh the various evidences, the ones that are in support of organ donations and those that are, in contrary to the permissibility of organ donation. So this is the reason why I think what we need to do is that, because like Arbada mentioned, there are two valid positions, and Islam is a religion where اختلاف أمتي رحمة, which means it's a source of mercy, having differences of opinion. And we have certain issues within Islam which are categorical. You will not find any two Muslim fiqh bodies, discussing whether, for example, alcohol consumption is permissible or not permissible in Islam. Some issues are categorical, absolute, clear, what we call qat'i. But this issue, because it's a contemporary issue, we don't have explicit text in the Quran and Sunnah, and therefore scholars have to deduce from the various texts. So there are texts like وَلَقَدْ كَرَّمْنَا بَنِي آدَمَ, which means, and that's really what the main source of the problem here is. or the main issue here is, which is the honoring of the human body. Does organ donation, transplantation contravene the honor, the dignity given to the human body by God? And that's what, and especially in a time where someone is in absolute need. And there are many classical scholars, hundreds of years ago, in light of the various texts, they actually said if somebody is dying if somebody is dying, that their life is threatened, they can, and if they found a human, this was this whole issue came up hundreds of years ago. This was a genuine difference of opinion between Muslim scholars, that they discussed that if somebody's life is threatened, can they consume the flesh of another human? Many scholars like Imam al-Shafi'i, which year was Imam al-Shafi'i? Over 1,000 years ago, he actually said yes, it's permissible. And there were some who did not. So that's why we have this very difference of opinion. So the point here is that, and I just have 4 points and I'm going to end with it, 4 brief points. The majority of the Muslims, how do we tackle this issue with them? We need to engage with the local faith leaders, the imams, the scholars, the Muslim organizations at the local level, grassroots level. Why? Islamic Fiqh Academy in Jeddah, Islamic Fiqh Academy in India has no relevance to the majority of the Muslims in this country. Many of them have never heard of what Islamic Fiqh Academy is in India or Jeddah or wherever, in whichever part of the world. These are international bodies, but most Muslims have not even heard of them. So, really to engage with the local faith leaders. Now the problem here is, unfortunately, sometimes, is that some of the local faith leaders are actually not even versed, like Peter mentioned, that people of faith sometimes don't really understand, and it's true. Even not just the people of faith, actually even the leaders sometimes do not really understand the issue, because they are not experts, because faith leaders are not meant to be medical experts anyway. So sometimes they don't know. So now we need to educate them. They need to understand what organ donation actually is. They need to practically get some training done. And they need to realize the importance of this, and then after that they can, it's a personal issue, so they can maybe then talk to them, they can discuss it, they can speak to their teachers, and then if someone personally holds a position after research that it's not permissible, we need to respect that. I don't want to say anything politically incorrect here as well, but we need to respect that position as well. If somebody does have that position that it's unlawful in my religion, they've come to realize, understand that based on their expertise, understanding, or their faith leader, understanding the issue and then giving this verdict to them, then fine. But most of the time, they don't understand the issue. Most of the time, people think, organ donation, like just yesterday, a friend of mine, I was just passing by and he said to me, I was talking to him about organ donation at this event tomorrow. He said, oh yeah, that's completely prohibited in the Quran, isn't it? I said, where did you hear that? He said, my grandfather was telling me that. I said, is he a scholar? He said, no, everybody knows. That's what people just think. So people are not educated. So really engaging with these organizations at the local level. Number 2, briefly, and I don't know how much time I've got left, maybe a minute or so. As I said, many actually believe it is outrightly unlawful, not knowing that there is a difference of opinion. Like this friend of mine, or this brother that I met, his grandfather said it's absolutely categorically, it's clearly, explicitly forbidden in the Quran. Not even knowing that there's a sound, valid difference of opinion, and actually the majority of the scholars do consider it to be permissible with the conditions and restrictions. That's the second point, that we need to sort of, many people think that, if people are informed, and they are told about the issue, that look, there is a difference of opinion, and there's actually a majority of the scholars, great scholars of the world, Muslim scholars do allow it, they would actually think twice. Really, scholars in this part of the world, that part of the world, they actually do allow it. Okay, then maybe I'm thinking I'm going to go into the organ donation register. They might do. But because they think its prohibition is like the prohibition of alcohol, maybe, they just don't even entertain the idea. It just does not come into the head. Okay, and finally, what we need to do also, one last point, is educating the masses. I think this is all related. Educating the masses of the real need of the people. Because sometimes what happens is that because it doesn't affect you as a human being. Like somebody was saying, the effect is done. It doesn't affect your family. It's very difficult. If it doesn't affect the person individually, then they just overlook it. They just think, okay, it's not my problem. We're human beings, humans are like, how humans are being created, very, very ungrateful, very selfish. So until it doesn't affect my family or it doesn't affect me as a person, I don't really even want to know what this is about. This is not my problem. It's got nothing to do with it. What's organ donation? It's got nothing to do with me. So I think educating the masses of the real need that people have and ask them to, deal with the issue or ask them to provide a position had they individually been affected by this. Say to them, look, if you or your family members had been affected, you were in need of organ donation, transplantation, how would you deal with this? Would you just say, yeah, my grandfather said it's haram? No, you would actually go into, my grandfather said it's lawful. You would actually go and ask scholars, what's happening, my brother needs a kidney. You will actually, that's what happens sometimes with many of us, that when we need something, we try to find, what we call fatwa shopping. If we need something for our favor, then we try to find a scholar who actually will tell us it's permissible. So maybe from that angle, if you put yourself in a genuine need situation, then deal with the issue, inshallah ta'ala. And I think that's it, maybe just engaging with the people, and I'm going to end with this. I'm sorry for taking so much time.
As alarming as the figures that you presented for the ethnic minorities in the UK, I just want to shed light in a different part of the world, which is my home country. 96% of the population is Muslim, so by and large, whatever I say about Pakistan can be broadened out and taken to be the stance of Muslims in Pakistan. Whereas the figures for the UK for organ donations from cadavers is over 2,000 per year. The same figures for Pakistan, no, I shouldn't say the same figures. The figures for organ donation from cadavers in Pakistan stands at 5. And that's in the entire history of Pakistan. That's not a daily figure, that's not an annual figure, that's 5 cadaveric donations. I think when a state does not provide the services, and certainly we are an unfortunate country, we are a third world country, people like me who want to make a difference, we can't because the state doesn't guarantee any sort of support. But it would be most unfortunate for people not to make use of these support systems present in countries like the UK. So I'm really glad that MSSN has actually allowed for such an informed discussion to be brought forward, and I wish this was replicated elsewhere. One recommendation, as great as this booklet is about mentioning about organ donation with regards to transplant, I think there should have been a paragraph on organ donation and tissue donation for research and for education purposes, because I do think that it helps, as we said, the whole purpose is to help another human being. Directly, it does not help save a life, but eventually it would. So I think as a recommendation, you should, when you revise the booklet, you should definitely put in a paragraph on that. Thank you.
Next question? How about we'll come to you next, Dave.
Hello. My question is to Mufti Muhammad. I'm from Kashmir, India. And my question is, in present day research, we generate organs from stem cells taken from the patient who is suffering. What do you say in that case? What does Islam say in that case? And in the labs, we provide artificial conditions, we provide artificial nutrients, and then the same organs which we produce from them, we put back into the patient. What do you say in that?
This stem cell research issue actually has been recently a topic of discussion. It's come to my attention. I've been asked a few times before. Many scholars are still studying and researching the issue. And actually, without going into the detail, the bottom line of the conclusion of the answer is that it is still a matter of debate between the Muslim scholars, and they have not really arrived at any one conclusion as of yet. So it's still ongoing.
Answer your question? Next question.
Hello, David Jones. I'm director of the Roman Catholic Bioethics Centre for the UK and Ireland. Within the Catholic community, and my understanding is also within the Jewish community, there have been debates not just about donation after death, but about how you tell if somebody's died or not. That is to say, the brain stem death criteria or the donation after cardiac death criteria. Is there a debate about that within Islam? Are there fatwas specifically about whether brain stem death is acceptable or not acceptable?
Right. This is very topical because actually Khalid is doing research on this topic right now. The reference that I remember reading was from the al-Kawthari of Jeddah. Now they discussed the definition of death, which is one of the articles coming up in a couple of months. And they recognize two forms of death. Actually, we quote them here, and we put references here. There is a discussion on cardiac death, when one's heart ceases to beat permanently, and there is brainstem death, when it is independently verified that one's brainstem has died. So those are the two definitions accepted by the Islamic Academy of Jeddah to be definitions of death. Now, I think your question is, how do we define that stage from a medical perspective? And I think the sources, the council leaves that to the expert decision. So in the sense that even in this country, the law, they wouldn't remove life until one can confirm death has happened. And there are criteria mentioned in the guidelines which the UK Donation Ethics Committee and so forth have strict criteria specifically mentioned. So it tends to, from my understanding, leave that specific criteria to the expert physician. And there is another point worth mentioning here, that one of the principles in Islamic law is that the custom plays a part in Islamic law. So one's society, societal norms, when scholars such as Mufti Muhammad, he was mentioning about how you have the lay majority, and that forms the majority, and a small segment of the community is expert scholars. So when they are concluding on a topic, one of the principles they use is this one, that the custom basically has a role to play. And the medical definition of death has a role to play when defining death. How do doctors define death according to their expert knowledge? So they do look at that. And it would be worth actually, and I think this is something that we need, because I'm not a scholar, I'm actually one of the lay people, but we need to commission more research on this topic. I mean, even if you look at some of the areas of further research, we actually find gaps where more work needs to be done. For example, reproductive organs. If you look at the wording carefully, we mentioned reproductive glands, okay? But reproductive organs, such as a uterus, in the near future, should that be, and we were told that there is something on the horizon, is that something that can be transplanted? It's a very great area in Islamic law. So, when we're looking to the future, and this is certainly an area where our organisation can help, is we need to commission further research for those experts who are capable of doing it. So I hope that answers the question.
We have a question that somebody's written down for. Okay. So Mufti Muhammad will come to that. It's one on blood donation, and in the meantime, we've got a question from the gentleman in the middle.
My name is Bilal. I'm a newly qualified doctor working in West London. To be honest, I felt a bit embarrassed that as someone who's fairly educated and who's done some reading about Islam, how ignorant I was when it came to Islam and organ donation. And I think maybe a lot of Muslims, like Mufti Muhammad mentioned, the assumption is that this is not permitted. And I was really blown away by how much research was done, even as far back as you said, 1988. When I was still in nappies, that people were saying this is something that Muslims could do and maybe should do. My issue, I have a lot of experience. My father, he organizes funerals in Leicester, so I've been to hundreds and hundreds of funerals. And I know the way Muslims interact with dead bodies and the level of respect and so on. And my issue is, as a doctor, I know and I see firsthand how people interact with dead bodies, how the nurses and how the people who work in morgues and so on. And like you said, Sir Peter, that maybe 6% of people in this country are practicing Anglicans. And the Christian, I think Paul says in the Bible, the body is a temple for the spirit. But very few people have this sort of respect and understanding. And I know to certify death, one of the things you have to do, you have to kind of speak, hello, can you hear me? And you have to pinch them. And I feel very uncomfortable doing that. You listen to their heart for 2 minutes. There's no heart sounds. There's no breath sounds. They're dead. But you have to pinch them according to to officially certify them. And that's something which I feel very uncomfortable doing. It's just, and it might sound very awkward and it might sound very different to the average person from a different faith tradition or who has no faith tradition. So my question is, do you think we can see the NHS having our healthcare professionals trained in a way that they interact with deceased bodies in a way that's sensitive to a really kind of nuanced level that's kind of that other people from other faith traditions, be them Muslim or Jewish or whatever, feel comfortable with? Do you think you'll see that level of training given to? Because I know I would feel so much more comfortable if I would feel so much more comfortable if I knew this is how bodies are treated when their organs are harvested, or when they die, or when they're transported to the morgue. Just like even a little nudge or a pinch is something which really unsettles me. So do you think we'll ever see that in NHS? Because I think that I think the Muslim community's got to come halfway across the bridge, and it's a big struggle to educate them and raise awareness, just like it is with the country. But there's also a move has to go on the other side.
That's a brilliant question. Thank you for that. I think Roberta just wants to add to that question, and then we can come to Gertz and to Peter.
I'm sorry to do this, because in our research, when we talk about respect, and this is what I was saying earlier, in your own guidelines, and I have written here, 36 recommendation. This is where we based our work, saying that in Islam one must respect the human body, and we said that in the UK they have considered this. This is based on this recommendation 36 of the UK Donation Ethics Committee's guidelines for controlled death after donation after cardiac death. They say, following death, the deceased patient must be treated with dignity and respect in line with their cultural and religious views in life. Now, what training has, as Bilal says, has actually happened for that to actually be in line with Islamic definition of respect and dignity? I mean, even pinching, Bilal saying that he's having problems with pinching the human being. So when you put forward these recommendations, is it a superficial statement, or is it followed up by a profound analysis of how different faiths define respect?
Right. Okay. Let's just go back for a moment and look at the Code of Practice for the Diagnosis and Confirmation of Death, which I chaired that as well as what I'm doing with the UK Donation Ethics Committee. The situation in that, if you read it, does not actually prescribe pinching people or any particular thing. What it lays out is clearly what physiological reflex you have to test. Now, how you test it is up to you, really, and there is no clear, nor do I actually think there should be anything clearly written down in a document that says if the deceased person is of a particular faith, this is what you must do. I think that actually is something which we should have sufficient respect for, whatever faith the body is, that we shouldn't do things which effectively would distress some people. What So what I think that one needs to do is to look at the recommendations for how you diagnose and confirm death. And you start off with, if you're talking about somebody who's had a cardiovascular death, you talk about listening to the heart and watching them breathe, and so forth. And how you elicit, the common way of doing it is no response to supraorbital pressure. Now that is eliciting a particular reflex here. If you don't want to do that, it's not essential that that is done, but there has to be a demonstrable way to ensure that the person does not react to pain. Now that's the difficulty, but I suspect the danger of trying to get too specific will actually get us into an awful knot. And I think that really, as a doctor, let me start again. Let me just come to, before we wrote this revised document, there was nothing written down in the UK that actually told junior doctors how to diagnose and confirm death. It was assumed you knew. Funny, isn't it? But that was the way it was. And it was made welcome that there was something that was written down. But within that, it is a question of how you elicit a reflex rather than you pinch somebody or whatever else. And I think you have to do what elicits sufficient stimulus for you that you're comfortable with. I don't think it would be very easy to say that you don't need to stimulate people at all, because actually then you'll be missing one of the criteria. Now, you could argue that if a person has sufficient time is allowed to elapse, that it isn't a problem. So actually, in all intents and purposes, frequently you don't need to do it, do you? To be honest. But in cases where we are talking about somebody who needs to have, where there's a time factor built in, then we need to have a way of doing it. I'd have to sit down with you and with others to work out what was best. In answer to your question, I do feel it's important that people are trained how to diagnose and confirm death in a respectful way. That's what we've tried to do. Within the context of that, I think there is an element of individual freedom.
Gertz was a member of the organ donation task force, and you continue to advise on the recommendations being implemented. And I know that training the clinical staff was part of those recommendations. Perhaps you can elaborate on how far that's come along.
Well, let me respond directly to Abada's question. I think it's really, really important that clinicians and the healthcare team in a hospital do respect people's values, be they cultural, be they based on faith. You're absolutely right, there's not enough training. It's probably not well enough resourced, it's probably not a big enough priority. That's not to say that nothing's happened at all. NHS Blood and Transplant did commission training nationally for all of the clinical leads in organ donation who are in post across every hospital in the country. Part of their training did include recognition and acknowledgement around faith and cultural issues. The challenge they now have is to go back to each hospital trust and ensure that they share that practice and then think about what's the best way of informing their clinical staff on these issues. Now, I can give you examples from around the world where I've seen it done well, and where what they do is they go out to their local communities. So that in other hospitals across Europe, for example, they go out to local faith leaders, they bring them into the hospital, they bring them into intensive care units, they bring them in to see transplants being performed, so people are familiar with what these issues are. They also then talk to them about death, burial, cremation, all of the rituals are associated with them. And essentially, there is a partnership formed between the hospital and its local community. That's what you want, because what you don't want, especially if you're the family, is to have a tragic bereavement and then find that someone is literally running around finding out, well, what's the, Christian position or the Sikh position or the Islamic position on this. The family are very distressed, and then they find that, oh, there is somebody in the community who can help them, but the person they call in has never had anything to do with transplantation before. That's just not good. So there are ways of addressing this if local hospitals do reach out, and one of the things I'm very keen to do is to work with local healthcare chaplains as well, because they have an enormously powerful position, an influential position, and they could help hospital teams to do this training as well.
I mean, just to add, I mean, one of the things as a medical student, one of the benefits I get is that actually I'm quite camouflaged in the clinic, and I actually see what goes on behind closed doors. And unfortunately, but it does happen, I have seen, you know, a Muslim patient come in, they say something, it doesn't click with the doctor, they see it, and they don't understand the mentality of the patient. As soon as the doctor walks out, they start to become very sarcastic and belittle the views of the patient. And I think I've seen that plenty of times, and because I'm so junior, unfortunately, you know, what I can do is very limited. But I've also had kind of chaplains through the work that we're doing here come and say to me, you know, your leaflet here is so important because now I can actually finally understand, you know, the views on organ donation. And the same with some specialist nurses. I mean, I've spoken to a few, and one of them said to me, you know, that it's the first time they've heard of some of these academies. And I'm just thinking to myself, this person is meant to be trained, I mean, from their perspective of trying to encourage someone to become a donor, and yet they're unaware of some of the fundamental basics of the ethical values that these people hold. And I think that, as Gus mentioned, that certainly there's a lot of room to not just get rid of this sarcasm, because it really does annoy me. It happens a lot in obs and gynae, for example. But also to just help support people in their work, and hopefully we can do this.
Just to add one thing, and that is that it is one thing to write things down in a document that's an official document within the UK, but it's another thing to see it implemented, which is, I think, what you're talking about. And I share that very much. I think possibly this is something which we could very helpfully deal with in the Donation Ethics Committee. There is no doubt that we're going to have to produce some guidance across all faiths for how certain issues are dealt with regard to organ donation and transplantation. It's another facet of, are you willing to do it? Do you have confidence in the process? And if you think that these things are not being observed correctly, people will not have confidence in the process. So I think that's a very helpful recommendation from you, and we'll take it on board. Thank you.
And thank you. I'm going to do a couple of quick fire questions to Mufti Muhammad, because I know that there's people who want to ask more questions. There's people in the audience have written. First one is, as a married sister, must one gain permission from her spouse to donate organs according to Islamic law?
Yeah, just a quick answer. I think it needs to be done mutually discussed, of course, in the family with your children, with your spouse, and it needs to be done mutually, with a mutual understanding, mutual discussion.
Is it invalid if the spouse disagrees?
What is valid? Her consent?
Yeah, signing up to it.
No, if she does sign up, then legally it won't be invalid, of course. So practically there won't be any difference, really.
If someone commits suicide, are you allowed to donate your organs to someone else who needs?
Can you take the organs of the person who committed suicide? Is that a question? Is that the question? Yeah. I mean, there's no difference. If the same rules of consent will apply to someone who's committed suicide, or someone who died naturally, or through a car crash, or whatever. So the same rules of consent that are discussed in this particular book would apply.
I think we have a question from the back, from one of the ladies, and then we'll come.
It was an incredibly fascinating and really informative event, so it's really lovely hearing all the views. One of the questions that I've got is sort of from an Islamic perspective, going back to the concept of knowledge, and as the Sheikh mentioned about the concept of having leaders in the community guide us and whatnot. I just wanted to ask a question from that perspective. looking back at history, for example, I know, for example, in the Indian sort of traditions, the Vedas, for example, they had that knowledge was something very sacred and very kind of, only the elite had access to it. So we had the different kind of caste systems and whatnot, which kind of led to later on, rather than people reading and seeing the books for themselves, kind of being led by a certain system of beliefs, which not necessarily represented what was actually there as sort of the true belief in the sense. So one of the questions that I wanted to ask was, obviously as Muslims we believe that what Allah has sent down is completely comprehensive in the form of the Quran and the Sunnah. So if a lay person was to make a decision and they looked at the Quran and Sunnah and sort of asked God for guidance, we have certain prayers that we can do and we've got certain, forms of asking for guidance ourselves, would that be considered okay rather than sort of in terms of having a concrete kind of a yay or a nay? Because because sometimes people get confused in terms of the scholarly sort of divisions and what kind of branch to follow, and so just want to see whether if they want to see if you want to kind of go back right to the root. And sorry, it's not very very different. I got really nervous at the other page. It was that.
Understood your question from the first sentence.
Oh, it's fine. I'm going to take it.
That kind of makes sense.
I'm going to do it perfectly. What I'm going to do is I'm going to take in a couple more questions and then allow the panelists to respond, just because I know there's a lot of people waiting. So whoever you've got at the back, and I know this gentleman's been waiting.
Hi, my name's Anas. Hi, I was just wondering, back to the point of educating the scholars or the imams at mosques. I know from personal experience, my dad was an editor at an Islamic magazine about these sort of topics, and when he brought up the topic to the sheikh of the mosque, should we do talks or should we do things on organ donation, he said, no, we don't want to go into that, it's a very grey area. What will the sheikh or anyone who is interested in this do to open up the doors for people who haven't been in contact with this sort of environment, haven't actually had the chance to think of it, or have had closed doors in their face?
Hi, my name is Shafiul. I'm a fourth-year medic here at King's. I'd like to address my question to Sir Peter Simpson. Would it be okay for us as doctors to give advice to Muslim patients concerning transplantation, whilst including advice from an Islamic perspective, or do you think that would contravene some of the professional boundaries that need to be respected in the doctor-patient relationship?
Right, so Sheikh, I think you have a couple of questions addressed to you directly there. One is about the ability of making an individually informed decision and whether it's important to get the opinion of a scholar, and the second is about how to get the message out there to the Muslim community. Okay.
Quickly, just brief answers for both questions. The first question, very important, very relevant question from the sister. Very would you. In terms of coming to a conclusion and arriving at a conclusion and trying to judge and decide for your own self, I think a great example for that would be if, for example, someone like me would, if there was an option for me to have an operation or not have an operation. Medically, I have nothing to do with medics, right? So I haven't studied medicine. Now, if I haven't studied medicine, and if I have no expertise, I'm not like Brother Abada here, with all the great knowledge, I just think, okay, I need to really decide, my family needs to decide, do I really have to have an operation? Is that operation good for me or not? And what I do is I said, okay, let me just sort of go, rather than ask Abada and the doctors and the medics and the professionals and the local GP or whoever, and think, okay, let me just go and really decide for myself, read the evidences myself. If I think I am capable, I do have some sort of expertise, and I think I won't make a mistake because it's about my own life. I'm very, very careful about my life. I don't want to end up dying before, so I will be very careful. Likewise, if someone thinks that, they do have the expertise, they have studied medicine, and the person, they can probably make a decision themselves. The same rule applies in terms of Islamic knowledge. We have experts in every field. It's not just Islamic knowledge. to be an expert. Nobody, no government, no lawyer, nobody will allow anyone to practice law, without having the training. So if somebody does think that they do have the training, they have the expertise and the understanding, and they can look at all the evidences, and they think, okay, fine. If somebody doesn't have that expertise, and most people, as I was saying, that the general public, if you go to all these cities, like from north to south, from London to past Leicester, the best city in the country, to Manchester, to Blackburn, to the north, you go to all the mosques, majority of the people, unfortunately, there is a lack of knowledge. People should study and learn about Islam. That's another extreme on the other side where people don't even have the basic knowledge. But we also have experts and expertise knowledge, and that's in every faith. Otherwise, all the cardinals and the popes and the bishops and the scholars will be out of a job. So, you have to have, expertise. So the general people will actually just consult their local imam, sheikh, and whatever they say will go. And we don't have to enforce it upon them that, no, you make a decision. If they have trust and confidence in their imam, then fine, that's because they have another job to do. They have to, go to the factory and work. They don't have time to study all of this, all these evidences. So they have expertise, they have this trust. And that's why I was saying that we really need to engage the imams and the scholars. And really, there should be some sort of forum, and this is where MHSN comes in. But there should be a forum where approach, I think, city by city, the main Muslim faith leaders, when we're dealing with the Muslims, of course, and approaching them, and maybe if locally, and this is also part of the second question, the answer, if locally I'm trying to answer both questions together, if locally we can get some sort of consent on the matter, because we have these different opinions, this fiqh body and that fiqh body across the world, but locally, if we engage, approach those people who are interested, those scholars who are interested, those Muslim leaders, experts who have some sort of understanding, get them on board, maybe have more and more events like this where it's openly discussed, people who are Muslim medics, who are experts, medical experts, and other non-Muslim experts as well, and create this awareness city by city. I think we could maybe get some sort of local consent, an agreed opinion, not 100%, because nobody agrees. There's nothing agreed in this world 100%. Everybody has it. There's only one thing that everybody agrees upon, that we're all going to die. But you will get good 70, 80%, 90% of people agreeing on one position. And once that is done, then this can be laid out to the community.
And I think the Sheikh made a good point that in terms of what needs to be done, but let's bear in mind that it isn't just a problem that's pervasive within the Muslim community. It's a challenge that faces Brits widely in all different kind of communities. The question for you, Peter, from the gentleman there was, how ethically appropriate is it as a medic to give advice on organ donation from an Islamic perspective to your capacity as a medical practitioner?
I think this is one of the things where a meeting like this, and indeed meetings with other faiths for us, have been so valuable. And that is, I think that we've approached over the years, we've approached organ donation and transplantation from a UK perspective, and have sort of assumed that everybody in the UK is a homogenous group. And actually that's not true. And I think what we're seeing today, and what we've heard recently, is that there are many people who actually have now that you live in the UK, now we live in the UK here is the opportunity to treat patients with a transplant, which wasn't always here, so we didn't actually have to answer the question, but now it is. Whereas, as the gentleman from Pakistan made earlier, it doesn't exist in Pakistan, so they're not actually necessarily confronted with it. However, to answer this question, it isn't reasonable for me as a medical practitioner to discuss the faith-related aspects of somebody's or relatives' willingness to donate when there are perfectly good experts around in every faith who can be consulted. I think that what we've got to try and do is to build into the organ donation process at some stage an opportunity for people to feel that they confidently have got the view of their faith leader. And that's what I think is a problem. It's not a problem if you look at it about whether or not you put your name on the organ donor register, because actually that can be done with lots of time, lots of thought, discussed with relatives, and so on. That's fine. The difficulty always comes with the time-related factors that surround organ donation at a very tragic moment. That's something which I think the Donation Ethics Committee has got to get its head round in terms of making some recommendations which will work. Because if we're here to remove obstacles, we've got to address the problem. If we say, sorry, we can't deal with that, well, the answer is then that person won't become a donor. So that's quite simple, and that's actually not what we want if their wish is to become one.
We're taking 3 more questions. Somebody there?
David. Hi, my name's Fozia. I'm a first-year human sciences student, and hopefully next year I should be doing cadaveric dissections on dead humans. My question is related, is asking how the rules of organ donation relate to entire body cadaveric dissection donations, because the rule for what it says in the booklet for donating organs is that it's only permissible if the transplantation either keeps the beneficiary alive or restores basic function, and that the consent is given first. Obviously, donating your whole body for the purpose of education for cadaveric dissection doesn't do either of those things, doesn't restore life in another person. So are we allowed to donate our bodies? And if we're not, then are we allowed to use them for our own education? Thank you.
Gentlemen, maybe just pass the mic. There in the second.
Hello, my name is Mahfouz Hassan. I'm a fourth-year medical student. Taking into consideration what I have said, that there are various Islamic bodies which said that explicit consent must be given in order for the organ donation to take place. Also, taking into consideration what Sir Peter said, that an opt-out system would disregard what NHSBT has said with regards to organ donation. Do you think that an opt-out system in England would create mistrust between the NHS and the other various trusts within the country? Also, how realistic do you think of an opt-out system being
One more question and then we'll come back to the panelists. Gentlemen, just
I'm Osman, I'm a second-year medical student. I am on the organ donor register, but there were 2 boxes which I didn't feel comfortable filling in. The first was the corneas of the eyes, because I read in this booklet that the maxim of necessity makes prohibition lawful is relied upon in order to violate the sanctity of the human body. So considering that eyesight is not a necessity per se, would that be permissible to donate? And the second one is the heart. I didn't feel comfortable ticking the box of heart after having flicked through some research by Dr. Gohan Mushtaq. He wrote a book called The Intelligent Heart, The Pure Heart, and it seemed a bit far-fetched at the time reading it, but he was writing about the heart having some capacity over psychology and personality, and so if that were the case, would that have any effect on the ethics of donating heart?
So Obada, first question you asked over there about donating bodies to research.
Okay, that's an excellent question. Was your name Fozia? Fozia? Okay. When scholars approach these questions, they have to. It's very, very important that they take a holistic approach. So, when you're looking at dissection in the lab, you don't do it for no reason. There is a purpose why medical schools do it. Not all medical schools do it, by the way, but there is a purpose for doing it. So what I'm going to say is that I think more research needs to be done into it in order to answer your question, taking that into consideration. There is an answer to it, but I would suggest that specific to the context in which you're thinking of, it's worth, and this hopefully something we'll deal with, but it's worth more work going into that. So I'm sorry I can't answer your question, but I think it's a fair question, and we need to be careful, because if you say no, if Muslim scholars say no, it causes problems, and there has been issues between medical schools, allowing their students to sit exams if they don't do their dissection or whatnot. So I think more work needs to go into that.
Gertch, the question of opt-out, I was waiting for somebody to ask that. I mean, the gentleman asked a question about would it increase the mistrust between the NHSBC and Muslim communities, and how likely is it, because obviously it's being discussed in Wales at present, how likely is it that we might see an opt-out system?
I can't preempt how governments think, so I can't answer the latter part of your question. What I can say for sure is I served on the task force when we looked at opting out and we ruled it out. I think it's really important to remember that the reason countries look at legislative change is because there continues to be a shortage of organ donors. That's what we need to remember. And I think genuinely most of the public do not appreciate there is a shortage of organ donors. People just assume, I'll join the transplant waiting list, I'm going to get a transplant. It's only when it happens to somebody, as somebody was saying earlier, and their family then start to realise this isn't quite what we expected. We're waiting months, we're waiting years. If you're on dialysis, you're being dialysed 3 or 4 days a week, a couple of hours a day, has a hugely detrimental impact on your quality of life, ability to work, family, etc. That's when people begin to appreciate there's a shortage of organs. So I think that's when legislative change is mentioned. So I'm not sure there would be a distrust, because what you've got to remember is if it's implemented well in any country, then there needs to be a properly resourced education campaign so that the public understands what opting out means, what actions are required if you wish to choose opting out. And I think the danger is that in some countries when it's introduced, a lot of the public automatically opt out without really appreciating what that means. And also some people just don't really understand what the law is. So I don't believe there is mistrust. Can I just respond to this issue about eyes and the heart? And firstly, just to confirm, that's nothing unique to you. I'm sure that probably doesn't reassure you. Across the world, most humans feel really queasy, if I can put it like that, about donating their eyes, their corneas, and also their heart. Okay, it's a commonly held belief. I guess the way I look at it is a bit like what Abada said. It is very difficult when you've got a patient who requires a cornea transplant, who requires a heart transplant, because especially the person who requires a heart transplant, they've literally, on the whole, got months or if not that weeks or days to live. And until you're in their position, you don't really appreciate what it's like. So absolute sympathy for your position, but I think we must remember that people aren't forced to join a transplant waiting list. I say this to all faiths. Nobody is forced to join a waiting list. You're asked, you could be dialysed for a kidney, or you can choose not to be dialysed. And some people do choose not to be dialysed and say, do you know what, I'd like conservative management, I'd like end-of-life care. But very few, interestingly. Also very interestingly, because I interview them as part of research, very few people consult their faith leaders when they want to join a transplant waiting list. I think that's quite interesting.
Just to, I'm going to come to Pete about going back to the opt-out question that you asked, because some of you might have seen last week in the Mirror, there was a big article by Sir Richard Branson about, he's got a friend and he's really passionate about people joining the organ donor register, and he's got a new campaign now to urge the government to introduce an opt-out system. And further down in the article, he says that, well, it has been considered under the Brown government, but it was because of those Muslims and Catholics that it didn't go ahead. Now, Gertch actually led that research. I immediately contacted Gertch and said, is it true? But, I mean, of course it wasn't. What Gertch's research showed was that all faith groups, and actually a lot of people are against an opt-out system because they would prefer informed consent. So I don't know, you might have seen that article, but...
Yes, we certainly saw the article. I think it's an example, really, of the problems you get when politics or personalities get involved with healthcare and think they can change the world and that their opinion's right. And the previous argument was about the UK-wide system was Mr. Brown favoured it, so it must be good. Now, Mr. Brown may think like that, but it would be sensible to talk to the people who are actually involved in trying to promote the organ donation register, look at the problems of why people don't sign up and so on, rather than, for me, what appears to be a rather bullying sort of attitude. I think the thing that worries me about it is it could rebound, because people could actually say, well, if that's what is going on, I shall just say no, I won't do it. And actually, at one stage, there was a suggestion that actually they would only have in Wales an opt-out register. In other words, you wouldn't register in an altruistic way as you do now. You'd simply opt out, and if you didn't, that was it. Now, I think that is an absolute recipe for disaster myself, really, quite apart from the fact that I think it removes from people an opportunity to genuinely be an altruistic donor. And so I'm actually not terribly enamoured of all that. I would much rather, as I said at the beginning, get us into a position where we increase people's confidence and understanding of a process and make sure that people at an early stage, Gertch has said and I've said before, at an early stage they consult with their faith leaders so they know what the situation is and there isn't any doubt, and that you feel confident and comfortable with that process, whatever it might be.
Can I put the mic here? And then we'll go.
Thank you. Fascinating discussion. I must make a confession. I'm actually Isam Ghanam, about my son. Like father, like son, I took a grant. I was a member of a medical organization. We took grant 64 to raise awareness on organ donations across the country. So we've been to most cities in England, and basically we only used the money to actually offer people food so they could come to mosques and community centers. And we've been on some channels, been on community radios and things. One of the things we also done, we invited imams to educate the imams. The common things we noticed are that scholars, the local imams, the local scholars, cut off from the Muslim world. And all these progress in understanding Islam has not actually reached them. And and there's no hierarchy in Islamic scholarship here. There's nothing like the Archbishop of Canterbury or the Chief Rabbi or anything similar to come and say to them that this is really not correct. You have to have a guideline, and the problem is complicated because some people really blocked. In Blackburn, we couldn't go to a single mosque or community center because they had a council of mosques, and that's forbidden. That's it. That's the end of the matter. I wouldn't discuss it. We wrote to 52 medical schools, which is a suggestion we thought we could put it forward to medical schools so we could include a lecture on
medical ethics, Islamic medical ethics, in every year when they teach, because it's part of the curriculum in that. Birmingham and Leicester took actually the offer, and we've been doing it every year. We go and give a talk for Islamic medical ethics. The other medical schools didn't take it seriously, but we've been going through Islamic societies, we've been evening classes, and like what they're doing here. So my suggestion is, if you could bring this to medical school and say, at least educate the medical doctors, because I've done this in that way. Yes, to bring it to the medical school.
I'm going up tomorrow, actually, to Hull and York Medical School to do just that. So it is on the way.
I think we're going to take just a couple, last round of questions. We'll take 3 more questions, and then we're going to have, so we've got one there, one here.
I'm Ahmed Bulla. I'm a physician in London. My first question is to Mufti Muhammad. It's a challenge, really. I think, as you quite clearly said, my experience echoes what you said earlier about lack of awareness. And I think this whole topic, the resources have been available for the past 20 years in terms of, whether it's Muslim or not, and Muslims really now do need to make a decision as to whether they decide that they are for ordination or not, and it's up to them, it's a personal preference they must make. My challenge is, how are we going to organise the Muslim communities, the clergy, to really take the responsibility to propagate this? As Dr. Ghamam has just said, that there has been poor cooperation so far for the past 10 years or so, despite the funds and material available. How are we going to change this, and what are we going to do? The second, my second question is to Gertch and to Sir Peter, in terms of opt-out. I know you've done a lot of research on this, but linked to the first part that I just made, in terms of raising awareness, a lot of the time people said that minority groups will be disadvantaged by the opt-out system. But there is also the group that says, if you actually make it directly relevant to these minority groups, they will actually take more of an interest, they will actually make that decision earlier, and actually that may well get them to make that decision, whether they're for donation or not. That's almost academic. They're actually making that decision as relevant to them and they understand it. So there may well be a role for the opt-out system to actually encourage minority groups for making these decisions.
My name is Kamal Ibrahim. I'm a final year medical student. Just very quick questions. First to Abida and Mufti Muhammad. With regards to, similar to what the previous questioner was asking, is there any work in progress with regards to getting UK scholars together to talk about the issues of organ donation and to sort of collate all of the questions which relate to organ donation in Islam? And is that an aim and objective of MHSN or any of the scholars that you know of? Is there any work in progress with regards to that in the future? Second question to Sir Peter and Professor Gertch. With regards to patients making conditions when they do donate, I was just reading in the booklet that there are no conditions that anyone can make when they give a donation. So, for example, let's say somebody were to donate their liver, yet they did not want someone who drinks alcohol, possibly, for example, to have that donation go to them from whatever faith. So, based on that being a wish of somebody, based on either their faith or their own, beliefs, is there any way that the patient's conditions or desires kept in mind with regards to who they can donate to? Because I understand the reason why it is unconditional, but is there any leeway with regards to this, or is there any consideration in the future of this being reviewed, or certain conditions being considered at the moment or not? Those are the two questions.
I think the first two questions are related anyway, because they're relating to how do we get to the faith leaders and get them more involved on this, and is there anything already happening?
In terms of the faith leaders, again, for our non-Muslim friends, we have to understand that when we talk about faith leaders and imams, we do have, even within the imams, two types of people, right? And there's nothing wrong or there's no deficiency in an imam not knowing anything about organ donation, right? I mean, if you don't study, it's a medical issue. Dr. Isam Ghalnam, father of Adam, I mean, he is an expert in medical issues as well as he has Islamic knowledge. And these other types of people will know about this issue. The vast majority of faith leaders don't really have an idea or a clue exactly what organ donation transplantation is. So that's really the problem. And they don't have an understanding. And as I said, they have Islamic knowledge. They are faith leaders, no problem whatsoever. But it's an expert issue. It's an expert issue. So I think what we need to really do is to sort of educate them, have seminars for imams, seminars for scholars, organized by maybe MHSN or any other organization. I know the difficulties, Dr. Afal mentioned, the difficulties in Blackburn. I know Blackburn, I can understand why you had difficulties there. But you have some of these, seriously, you have these places where, it's just the cultural, emotive type of atmosphere where, let's say, people don't want to know anything that comes from anywhere else. Maybe because you may have been, unfortunately, for them, from a different background, and that may have caused a problem as well. So I think what we need to do is tackle and connect with expert scholars who have some sort of understanding of Islamic medical ethics, organ donation, get them on board, like MHSN is doing, and then those scholars, along with the medics, the second phase would be to educate the vast majority, the imams, the clergy, the scholars, and then use them as a medium to educate the masses. I think that's the procedure that needs to be put in place, inshallah.
The second part of Kamal's question was, with regards to preferences about who gets your organs. And then we've got another question that somebody's written about, is about whether you can actually have a preference about whose organ you receive. Say, for example, if it was an alcoholic, or, as a Muslim, obviously you don't drink, so what if it was somebody who did drink excessively? So, Gertz, do you want to elaborate on that?
Also get this question. Okay, let me answer it this way. In the 90s, there was a family up in Sheffield. We seem to be picking on different parts of the country. I want to say I have nothing against or for Sheffield. But there was a family in Sheffield, and they did try to specify the ethnicity of the recipient. And essentially it was a white family and they wanted the organs to go to a white recipient. I think you should definitely not have any kind of preference criteria. Now, can I go back to the other question, which was about opting out does promote potentially action? I think there are different ways of react. You can use advertising campaigns, you can use grassroots initiatives, you can use legislative change. All of these things, I think, have an effect. I think, as Sir Peter has suggested, the problem is with different kind of routes of engaging the public, you could have some of them that backfire. And we must be mindful of the media. The media have a huge role. So what I would like to see is the media portraying this issue in a positive way, to sort of say, here is the British public recognising there is a shortage, celebrating those families who then do take that courageous decision to donate their loved ones' organs, and celebrating the fact that people have lived as a result of that. We don't do that enough in this country. You hardly see any coverage of people who've made that fantastic decision. What we do see is lots of negative stories around organ donation and transplantation, and my fear genuinely is that sooner or later we'll reach a point where somebody's going to start to say, and they're not manipulating the statistics, they are the statistics, they're going to start saying 90-odd%, higher than that, of donors in this country are white, and yet the recipient waiting list is mainly non-white. Why are the refusal rates higher amongst particular ethnic groups than others? I personally think we have an opportunity, a bit like today, to stop that kind of press release, that kind of media coverage, if people are willing to step up to the plate and deliver these grassroots campaigns. I think somebody's mentioned it, actually too many people have probably mentioned it, that people who are saying, oh, we don't need to talk about it, well, they're the ones who are then going to be probably responding to all this negative press publicity, and we really do want to avoid that.
We're about to finish, but we've got one last question from Mufti Muhammad here, and it's about somebody's written, I think there's a couple of them, people have written questions about, when we've been out doing these kind of events, there's a very popular hadith that keeps coming up about, in Islam we have to maintain the sanctity of the dead and show a lot of respect, and there's a famous hadith about breaking the bones of the dead, and I think people kind of interpret that to say, well, if you can't even break the bones, how could you, organ retrieval definitely mustn't be allowed, so would you like to know?
You see, this whole issue, and the booklet that we have in front of us, there's no time right now to sort of have a whole lengthy 2-hour, lecture on the permissibility or the otherwise of organ donation. We had a NHS and organized an event, I think last year or so. Dr. Islam actually gave a presentation on this particular issue. There are evidences, as we said, it's not absolutely crystal clear in the Quran or Hadith. There's nothing like Ya ayyuhalladhina amanu, or you believe organ transplantation is halalun or something like that. Okay, so it just has to be extracted. Now there's evidences on both sides, and that's why you have, if the scholars, and actually personally I've got an article that I wrote in quite detail. This is Brother Azada's article, but I wrote one before. His is much better, of course. Where I talked about the view of permissibility, the view of impermissibility. This was like 6-7 years ago. And all the evidences of those Muslim scholars and experts who consider organ donation to be impermissible, and those who consider it to be permissible. The ones who consider it to be, and within, some of them are actually of the opinion that completely is just absolutely, whether it's from a live donor, whether from a dead body, whatever, it's just not allowed. They're in the minority, but there is that position that it does exist. And I also have to say here that if somebody does choose to hold that position based on their understanding, based on, after understanding what the issue is, if it's out of ignorance, they're just like my granddad said, it's haram, it's not allowed. Not that kind of understanding, but somebody actually follows a particular school or a scholar who is actually well-versed, understands, and after his research, his religiously believing that he has this belief that my faith does not allow me to take or receive organ donation, we have to respect that. I think we really have to respect that as well. But that's in the minority. But the majority, as I said, they do allow. I don't know what I was saying. I just forgot halfway through. What was I just saying just before that? To answer the question, sorry. Yeah, so there's evidences on both sides. And all those evidences, like the breaking of that's a hadith in Sunan Abu Dawud, to break the bone of a dead body is like the breaking. All of these, there's not just that evidence, there's many, many evidences, and there's explanations, interpretations, and I don't want to sort of go into all these interpretations. You see, the bottom line here is all those evidences that do sort of indicate the impermissibility, like the karama, the honor of the body, the sanctity attached to the human body, and all those evidences. The viewpoint of permissibility is based on the famous juristic principle, which is ad-darurat tubihu al-mahdhurat, which means in Islam we have this principle that necessities make prohibitions lawful. So if someone's dying, if someone's life is at danger, and I think there's a brother here, he had a question and we couldn't answer it, where it's someone's life is threatened or you're actually enhancing that person's life, it's a critical part of their life. It doesn't have to be life-threatening, it doesn't mean that the person has to be dying, but it has an enhancement on their life. Then Islamic law, this is the agreed upon position that prohibitions do become permissible. So even if it's originally something that's not lawful in Islam, but because of the absolute need and necessity, Islam even allows the consumption of pork and alcohol in cases of need and necessity. So along those lines, it does become permissible.
Sheikh, well, time's coming to an end, so I'm going to give each of our panelists just a quick minute to give us their closing remarks. Coach.
Quick minute. means a minute, I guess. Two things to me. The most important thing really is to talk to your family and friends about it. But what I would cover in that conversation is if they ever, or you ever required a transplant, would they say yes? And I think that's the kind of conversation people need to be having. And then regardless of whether it's yes, I'm supportive of organ donation, and no, I'm not, it's so important to let your loved ones know.
Thank you. First of all, thank you very much. I've learned a lot tonight from the questions. And there are three things that struck me, really. One was the remark that was made at the beginning, which said that actually there is a close relationship in Islam between the willingness to accept an organ and giving an organ. And I think that, for me, implies that we all live here in Britain in a situation where healthcare allows transplantation. Therefore, because we live here, we really do need to form a view on both those sides, given that Islam actually links the two together. And that, for me, should be a starting point for individuals to talk to their faith leaders, to their families and everything else, and make a decision about what they feel this form of treatment that is available here is something they wish to engage with or not. And I think that's a decision that all adults should be able to do. I do also take the second and third points, which were the ones about the advice which UK DEC can seek to give around respect when death is being diagnosed and sufficient time for people to have the opportunity, even in a time-constrained environment, to be able to find out what their faith leaders actually think. And those I will try and take with me, and thank you.
Thank you.
Closing remarks. I just think we need to sort of learn more about this topic, educate the masses, and also what I think most of the people are saying, try to put yourself in a position that you yourself or someone in your family, a close family member, may be affected, and then how would you deal with it in that particular situation? That's how I look at the situation or the issue for myself. That if I was affected, my family members were affected, how would I deal with it? How would I approach it? And then, put yourself in the firing line and then deal with it. I think that's the way. And just one point, Dr. Isam might find this quite intriguing. There was one scholar who actually had the position. No offense to him, but it just shows what happened. He had a position of the impermissibility of organ donation. He had a case in his family where I think one of his children actually needed a kidney or something. He actually then revised that issue. He looked into it, and it made him understand. I'm not saying there's anything wrong with him, but what happened? It actually put him in the firing line where he actually thought about the issue practically. It affected him, and then he actually changed some of his views and positions as well.
Well, I don't know what more to say other than the fact that I think this is not an end but a beginning. And even though we've done this research, and I've spoken to Natalie about this before, that there's so much more to do, and not just in terms of disseminating the information and actually getting people to make a decision for themselves, but I think there are actually a lot of areas where we, as MHSN, can bring together scholars and the bodies who are seeking opinions of scholars to have discussions about certain things, including the NHSBC and UK DEC and so forth. So I'm very keen, on behalf of the team, to kind of get these discussions rolling, to commission scholars. I mean, one of our reviewers, Sheikh Rizwan Mohammed, he's based in Scotland, yet we met him, and he was saying to us there hasn't been yet a proper ratification of the Human Tissue Act according to Islamic law. Now that is, to me, that seems quite fundamental because, in essence, the whole system is based on this act as well as other things. But it's important to have these kind of bits of discussion going and getting scholars to do a good job of their work. And I think a lot of it would need support of kind of organisations interested in this. And I'm certainly keen on getting this forward. like I said at the beginning, we're not trying to push a particular agenda. We're only trying to get people to think. And if you think, put yourself in the firing line, make a decision, then at least that's beneficial than not doing that.